Welcome back, folks. forpay.org. This is Consumers Doctor, Dr. Bengala. So what are the solutions? Let's look into solutions, how we can solve dysfunctional healthcare. There are simple solutions, folks. It should not, the goal is it should not strain the government. It should be good for everyone, including the insurers, hospitals, providers, and especially the consumers. Yes, there is a solution, folks. Simple solution. And I don't want to make this as a political argument. Most Democrats believe in it. Even Republicans will go along with it. The reason I say that, this is a public-private partnership, folks. Public-private partnership. You have to have a health review authority under the public-private partnership. And you need to have 15 member board, whatever you may call it. Their goal is to gather the information. If someone applies for the insurance, if they get rejected, automatically it goes to the health review authority. They will review the application and they will give you a certificate of guaranteed coverage. That certificate of guaranteed coverage, you can take it to any insurer, participating insurer. Yes, participating insurer. They'll love to have them because you know why? The payments are made through health review authority. So you may ask, where are the funds coming from the health review authority? Well, it's all federal and state. They already have a system, folks. They're pumping so much money into this Medi-Cal, which is not working. Even Medicare, as far as I could see, there are a lot of problems with Medicare. I know a lot of seniors. I'm a senior. I love Medicare. Don't take me wrong. I don't want to lose my Medicare. But Medicare has to be addressed towards the common man for all seniors. What Medicare is doing is wrong. They are pumping the money into private companies. You and me and millions of 50 to 70 million folks. Out of that, at least I'm pretty sure half of them are in the managed care. So what Medicare is doing, they're taking your healthcare dollar and giving it to a private insurer or to the medical groups, so-called managed care organizations. And now these managed care organizations have started consolidating. These medical groups they also have these contracts. They get paid $1,200 per member per month. This is called Medicare Advantage. Medicare Advantage, folks, don't get carried away with Medicare Advantage. It is a Medicare disadvantage. You know why? They're taking away your choice, man. They're taking away your choice. You can't go to the doctor you want. You cannot go to the hospital you want. They control your life. Yes, they do. They make the decisions for you. You need to have a co-pays and deductibles and authorizations. Who the hell wants to go through all this nightmare if you want something done? So instead of giving this $1,200 to this managed care, so-called managed care organization, Give it back to us, to the seniors. I want my healthcare dollars back to me so I can manage my own healthcare. I can buy the best healthcare coverage I can get through my decisions, not somebody else making the decisions for me. Yes, if I would get $1,200, if I'm healthy, I would go and buy a deductible health insurance. You know, the premiums are based on deductibility, obviously. If you have a high deductible, your premiums are lower. And whatever the money I save, I should be able to put it in my health savings accounts, man. Health savings accounts are the way to go. That's health savings accounts. You have a control. Your ultimately the funds in the healthcare, you and your family gets to keep it. That is your money. That's the way to go. Under the public-private partnership with Health Review Authority, should be able to provide the healthcare for the most indigent, most physically and economically impaired group, and they get private health insurance. How about that, folks? This Medi-Cal, I'm not so sure about it. Medi-Cal, most of the providers don't want to take it. So that's a simple solution, guys. Is that straining the federal government? No. It is under the public-private partnership, which actually is interesting. All the larger employer groups like Walmarts, Googles, Amazons, you're talking about 170 million larger employer groups are already self-insured. They have the self-insurance. The problem is we're not focusing on mom and pop businesses, small businesses. That's where the problem is. And another thing is, if you really look at it, the numbers, people are economically and physically impaired are only 2 to 3% of the population, man. You don't think the US can take care of this 2 to 3% of the population with physically and mentally impaired group? Come on, you're spending $3.8 trillion. You're wasting all that money. Give it back to us. We will take care of it. And under the public-private partnership, resolve this once for all, this healthcare so-called debacle. Hey guys, I love you. I'll continue to love you. This is my lifetime passion, man. Before I die, this is what I want to achieve. Is healthcare has to be consumer driven. And you need to take care of your own health, man. Nobody else should. So it should be consumer driven. If there's a value in this video, continue to subscribe, share, and make some comments. And we will address several topics. So we will see you in the next episode. Thanks. Goodbye.